Hello, welcome, and thank you. Together, we, Northeast Delta Human Services Authority, and you are building stronger communities together, one person at a time. Northeast Delta HSA is a trusted resource for credible information, evidence-based programs, and guidance. We are here adapting our services to meet community behavioral, physical, mental, and social health needs. Northeast Delta Human Services Authority is led by Dr. Monteic A. Sizer, Executive Director. Collectively, we are all directed by our vision, mission, and tenets. Our vision: to build a unified Northeast Louisiana where individuals are thriving and reaching their full human potential. Our mission: to serve as a catalyst for individuals with mental health, developmental disabilities, and addictive disorders. And our tenets that guide our actions: greater access to services, excellent customer service, and quality, competent care. This webinar series by the Prevention and Wellness team at Northeast Delta HSA is here to improve education awareness, advance community discourse, and focus on recovery during social distancing and other issues enhanced by COVID-19. Today's topic: how to adapt, cope, and respond to COVID-19, with Kara Jackson Etienne, licensed master social worker, and Dr. Avius Carroll, Prevention and Wellness Services Director.
Thank you, Alan. As stated, I am Dr. Avius Carroll, and I am co-presenting with Kara Etienne. As we continue to live through this pandemic, we thought it was helpful to address some of the known issues associated with COVID-19 and talk about some ways to adapt and cope. In addition, we wanted to bring two perspectives to the training. I am a public health professional with a background in health policy and management, and Kara is a licensed master social worker with a background in mental health and renal social work. So you might hear some different approaches to the conversation as we progress. Although COVID has been tracked prior to the state guidances and protocol for responding to it, as a nation, we really did not start the adapting phase until March 2020. I remember this because Northeast Delta had two major events scheduled for late March and early April. At that time, a national directive was given not to convene in groups larger than 100 people, which we quickly know reduced to 50, then 10, to individuals living in the home with you. This triggered a collective behavioral change in adaptation.
Thank you, Dr. Carroll. There have been numerous changes that the LaSoar team has experienced as well due to COVID-19. As an outreach team, going out into the community and providing prevention education and Narcan trainings is at the core of what we do. Due to COVID-19, that all changed. Our scheduled outreach events and Narcan trainings had to be canceled. National Prescription Take-Back Day in April was canceled, as well as our mobile grief counseling groups. Our reality and new normal now is finding ways that allow not only our safety, but those we are committed to serving safety as well, while continuing to meet them where they are. Some of the things that we have developed in addition to this series of webinars are offering the Narcan training through a virtual platform, coordinating with community agencies to distribute opioid education materials, and DETERA, which is a safe method of disposing medication in the home, to those they serve in the form of opioid response kits. Dr. Carroll, it is Northeast Delta Human Services Authority's goal and the LaSoar's team to ensure that we are continuing to help those who need us the most.
So let's take some time to talk about adapting. Adaptation is defined as changing when conditions are gradually or suddenly different. Before Kara talks about general methods of adapting, I want to acknowledge that positive change can be just as hard as negative change. Some ways to adapt is to find acceptance by understanding who has the power of the situation and what caused it. Facing your fears. Fear can paralyze you from making progress and from growing. changing your perspective. As much as change can be painful, it also makes you grow. Remain faithful and motivated to see the positives that come from reconstructing your outlook. Find support. Admitting that we need help is hard, but you'll be surprised how many positive people respond, and also how many people are suffering with some of the same things.
Thank you, Dr. Carroll. I want to review adapting and point out that it is adjusting to new conditions that change either gradually or suddenly. It is done in most instances to help us survive. Typically, we adapt in three ways: behaviorally, psychologically, and structurally. Let's review each a little further and apply these in relation to COVID-19. Adapting behaviorally is changing how we do things. As it relates to COVID-19, it's practicing physical distancing by remaining 6 feet apart, wearing a mask when we go out, only going out for necessary things, and planning for when you go out in order to make as few trips as possible. Adapting psychologically is changing how we think and feel about things. While there has been many changes that affect our normal day-to-day routines, instead of viewing them as an inconvenience or problematic, tell yourself that these changes or adaptations are for your safety as well as others. And finally, adapting structurally are changes that are made by yourself in your homes and in businesses that we frequent. Some of these changes are washing our hands immediately upon arriving home, removing clothes and shoes in specific areas, especially for those who work in healthcare or other high-traffic agencies, grocery stores having a time for senior citizens only to shop in the first hours of opening, and reducing the amount of customers in at a time and having directions in the aisles for flow of traffic are just a few of the structural changes that have been made. Adaptation is essential at this time in order to keep ourselves and others as safe as possible.
Carol, I was reviewing a journal published by Psychology Today, and it stated, if the changes in your life are overwhelming, you don't have to deal with them all by yourself. Friends, family, support groups, and counselors are available, but you have to reach out and ask, which can be hard. One of the reasons we started this series of webinars was to let people know we understand and we can help. Towards the end of the webinar, Carol will spend some time to talk about the services we provide here at Northeast Delta HSA. Here you see a diagram of a pandemic tracker produced by the World Health Organization. As you can see, there are many phases leading to a pandemic. As noted, COVID-19 has reached pandemic phase. In order to properly review the phases, I'm going to use the information from the H1N1 response in 2009. I will use the term influenza several times, but I want to disclaim that I'm not saying that COVID-19 is a strand of the flu. I am using this H1N1 response as an example. Phases 1 through 3 correlates with preparedness, including capacity development and response planning activities, while phases 4 through 6 clearly signal the need for response and mitigation efforts. Because we are currently in a pandemic, I'll review phases 4 through 6. Phase 4 is characterized by verified human-to-human transmission, which is able to cause community-level outbreaks. Phase 4 indicates a significant increase in risk of a pandemic, but does not necessarily mean that a pandemic is a foregone conclusion, meaning high alert, but still containable with potential to mitigate without progressing to Phase 5. Phase 5 is characterized by human-to-human spread of the virus in at least 2 countries in the World Health Organization region. While Phase 5 is a strong signal that a pandemic is imminent and that the time to finalize the organizational, communication, and implementation of the planned mitigation measures is short. So the window begins to close at this point, which leads us to Phase 6. Phase 6 is the pandemic phase, characterized by community-level outbreaks in at least one other country in a different World Health Organization region, in addition to the criteria defined in Phase 5. Designation of this phase will indicate that a global pandemic is underway. There's more information about the stages leading to a pandemic available on the World Health Organization website. We want to spend some time with the slide to highlight each individual level and further place emphasis on the importance of a pandemic and how critical it is to adhere to all state guidances for adapting.
Following Dr. Carroll's breakdown of the phases of a pandemic, now we'll take a look at what we know about coronavirus. It was first identified in Wuhan, China in December 2019. By January, clusters of cases of a mysterious pneumonia were being reported in Wuhan. At the time, the world knew almost nothing about how the virus was spread or how to treat it. And in the following weeks, person-to-person spread of the virus was reported around the world. In early March, the World Health Organization declared COVID-19 a pandemic after the outbreak was transmitted in more than 100 countries, including the U.S. Scientists and public health officials are working as quickly as possible to find answers to key questions about how the disease is transmitted and why some cases are more severe than others, while also investigating treatments and a potential vaccine. Now, a little over 6 months later, our knowledge has grown and discoveries are still being made daily.
Kara, I am sure you have heard many myths about COVID-19 since the pandemic started. The wonderful thing about the internet and social media is the vast availability of information. The downside is a lot of information is circumstantial, trivial, derived from fear, or created to instill fear. There are many sources of information at your disposal. Some great fact checkers and myth-busting sites are CDC, World Health Organization, and your local governing and state agency websites. These 4 resources can provide you with up-to-date and accurate information as it is being developed and defined. A few common myths are: warmer weather will stop the spread of coronavirus. Exposing yourself to the sun or to temperatures higher than 77 degrees Fahrenheit does not prevent the coronavirus disease. You can catch COVID no matter how sunny or hot the weather is. Countries with hot weather have reported cases of COVID-19. Social distancing isn't necessary. You've already been infected. Social distancing is a standard protocol during the pandemic based on the transmission of COVID-19. Most of the people who catch COVID-19 can recover and eliminate the virus from their bodies. Although the risk is severe illness may be different from everyone, anyone can get and spread COVID-19. There is more information available for additional considerations for individuals living in close quarters, living in shared houses, and people with disabilities and experiencing homelessness. Alan, please share the link in our chat room. If you don't have a fever, cough, or shortness of breath, you don't have COVID. Asymptomatic individuals can be silent spreaders of COVID-19. A Georgetown study concluded that there is evidence that COVID-19 has the ability to spread silently. Silent spreaders can be divided into 3 categories: asymptomatic, pre-symptomatic, and very mildly symptomatic. For clarity, asymptomatic means you are not experiencing any symptoms, and that it's dangerous to go outside during the pandemic. CDC warns to limit close contact with others outside your household in indoor and outdoor spaces.
Yes, Dr. Carroll, those are many that I've heard. And some of the others that I've heard are ingesting disinfectants to treat coronavirus. These substances can be poisonous if ingested and cause irritation and damage to your skin and eyes. Bleach and disinfectant should be used carefully to disinfect surfaces only and should be kept out of the reach of children. Do not under any circumstances spray or introduce these substances to your body. And I read an article that discussed this a little bit further, stating that how many people have been going into the emergency room based on some of these things that they have tried themselves. Mosquitoes and ticks transmitting the virus. To date, there has been no information nor evidence that suggests the virus can be transmitted through mosquitoes and ticks. Remember, this virus is spread primarily through droplets, and young people won't get sick. While older adults and people with chronic health conditions are at a higher risk, it doesn't mean that young people are immune from it, and lots of younger people are getting severely ill when it's otherwise not expected because of their age. There is so much information that we don't know and that is being identified daily that I feel it's important for me to remind you to always go with what is factual and has been provided and reported by reputable sites. This data is as of June 25th and is constantly being updated as information is being discovered.
I love talking about resiliency. It is an important protective factor that we talk about in prevention and wellness. Resilience is the ability to bounce back from stress, adversity, failure, challenges, or even trauma. All kids encounter stress at varying degrees as they grow. Kids get sick, move to new neighborhoods, encounter bullies and cyberbullies, take tests, cope with grief, lose friends, deal with divorce, to name a few. These obstacles might seem small in the eye of an adult, but they feel large and all-consuming to kids. In the midst of COVID-19, it's important to build resiliency and be able to support and foster in our youth. To better understand resilience, let's discuss the 7 C's of resiliency. Competence. Children need to be seen when they are doing something right. We need to recognize this and let them know we've noticed and encouraged them. Confidence. The solid belief in one's own abilities is everything. We need to be careful not to undermine confidence, but develop it by pushing children to achieve and creating age-appropriate opportunities for experienced success. Connection. Close ties to family, friends, schools, and community give children a sense of security. Character. Children need an understanding of right and wrong. A fundamental sense of right and wrong helps children make wise choices, contribute to the world, and become stable adults. Contribution. Once children understand the feel-good factor of helping others, it becomes easier to ask when help is needed. Being willing to ask for help is a big part of being resilient. Coping. Children need healthy coping strategies to manage their stress. Some strategies involve engaging and disengaging, such as breaking down seemingly impossible problems and challenges into smaller, achievable pieces. Control. Children need to feel they have a degree of control over their lives and their environment.
Following what Dr. Carroll just discussed on children and resiliency, let's now look at techniques that can be used to talk to children about COVID-19. Children may worry about themselves, their family, and friends getting ill with COVID-19. Parents, family members, and other trusted adults can play an important role in helping children make sense of what they hear in a way that is honest, accurate, and minimizes anxiety or fear. It's important to remain calm, as children will often react to what you say and how you say it. Provide reassurance that they are safe. Be sure to listen to what they have to say. Provide information that is truthful and appropriate for their age, and teach and reinforce everyday actions that reduce the spread of germs. You can tell them things like, there are very smart people whose job it is to take care of public health and are working on ways to protect us all. Most people who have this illness are okay and back living healthy lives, and there are lots of helpers such as doctors and nurses that are helping people to get better every day. It's important to keep the conversation going and discuss as new things develop by allowing them to ask questions and you question them on their thoughts and feelings. Remember, public health emergencies are not easy for anyone, even us adults. Many children may feel frightened and confused, and we can best help by listening and responding in an honest, consistent, and supportive manner. Fortunately, as Dr. Carroll stated, most children, even those exposed to loss or illness, are quite resilient, and by creating an open environment, we can help them cope with stressful events and experiences and reduce the risk of lasting emotional difficulties. As a behavioral health agency, One of the populations that we serve are people who suffer from addictive disorders. COVID-19 is posing an immediate and longer-term threat to those who struggle with addiction. Necessary coronavirus containment measures like physical distancing and closure of public spaces are making it harder for people with substance disorders to seek help, keep up their treatment regimen, or access social support groups. According to Samantha Arsenault, VP of National Treatment of Quality Initiative, groups such as AA or Smart Recovery have been shown to increase members' ability to cope with risky social context and negative emotions, reduce impulsivity, enhance well-being, among other positive effects. While they are often done along with individual therapy, medication, and other interventions, many people do rely solely on groups, and with physical distancing, millions of people in recovery are now without a crucial lifeline of support.
Carol, this is a perfect segue to social determinants of health. Social determinants of health include aspects of the social environment such as discrimination, income, education level, and marital status. The physical environment, such as your place of residence, and built environment, such as your transportation system. And lastly, health services, access to care, quality of care, and your insurance status. Substance abuse, drugs, alcohol, or both, is associated with a range of destructive social conditions, including family disruption, financial problems, lost productivity, failure in school, domestic violence, child abuse, and crime. Negative impacts to social and economic factors such as changing in your routines, increased free time with nothing to do, layoffs and not having access to sick leave can trigger certain behaviors or exacerbate existing ones. This plays well into resiliency. Resilient behaviors manifest positive outcomes in both children and adults. Seeking counseling and maintaining close support systems can help navigate through social determinants of health caused by addiction. Now we'll move to section 2 of the presentation, coping. Coping is defined as dealing effectively with something difficult. I think that many of us can attest to COVID-19 as something difficult. Prior to us scheduling this webinar series, I participated in several webinars that discuss ways to cope with COVID-19, which is a testament to the need to educate individuals on how to live with the new normal. Coping plays a vital role in not only managing our mental and physical wellness, but also being a good neighbor by adhering to guidances that limit social interaction. Although coping with isolation is not the only component of changes occurring from COVID-19, it is a major one. Other noted issues are coping with behaviors, coping with your fears, coping with your finances, or potential exposure on your job. This list isn't conclusive, but gives you an overall idea. Below are 6 emotion-focused coping strategies, which all of these can be executed with the help of a professional or support group.
Here, we will begin to review coping strategies that we all can use in remaining safe. We're going to look at physical distancing and remaining physically safe. Staying home is the best way to stay safe and reduce the spread of COVID-19. This means keeping space between yourself and others even when you go outside of your home. In addition to keeping space between yourself and others, you should also limit close contact with those you encounter in indoor and outdoor spaces. Since people can spread the virus before they know they are sick, it is important to stay away from others when possible, even if you or they have no symptoms. Social distancing is especially important for people who are at higher risk for severe illness from COVID-19. Many people have personal circumstances or situations that present challenges with practicing social distancing, which Dr. Carroll previously mentioned among the social determinants of health.
Media can be an overwhelming resource and library of information. Much of the information we receive through media can be accurate based on a moment in time. The issue is too much of it can create some feelings of stress, anger, depression, and anxiety. Some recommendations to help combat negative reactions and responses to information overload are to limit your engagement, avoid media before going to bed, and being considerate when sharing information to family and friends.
Let's look at maintaining social support. There is a human need for healthy social connection and support. So while we are encouraged to physically distance ourselves, it is critical that we remain socially connected in order to not feel isolated. According to Casey Tillman, in an article written for Behavior and Society, while scientists are rushing to understand how the coronavirus works, researchers have long understood the toll that social isolation and loneliness takes on the body. People who do not feel connected to others are more likely to experience depression, have lower cognitive function, and live a shorter life, among other things. Now is the perfect time to practice using technology in socially healthy ways, such as FaceTime or other methods of video chatting, phone calls, and texting. You can even get more creative by creating group chats with family and friends and using other platforms to host family calls. Use this time to nurture your existing relationships in new ways. While the coronavirus has reminded us that human connection can spread illness, it is also a reminder that human connection promotes wellness. Let's take this opportunity to recognize the importance of relationships for our health and to practice using technology for social well-being.
I was listening to a podcast last week, and one of the psychologists recommended giving back and acts of kindness as a protective factor during COVID-19. People are coming together to sing on balconies in Italy. Others are setting up groups to offer support to the elderly or vulnerable, like collecting groceries or calling them for a chat. We have heard stories of people having virtual movie nights and creating choreographed dances over video chat to share with the world. The added benefit of helping others is that it's good for your own mental health and well-being. It can help reduce stress and improve your emotional well-being. In short, doing good does you good.
Focusing on health and wellness. The stress of sheltering in place and fear of the unknown has left many of us stressed, socially isolated, or just plain bored. But there are things we can all do to help make these days better and to stay healthy. Keeping yourself healthy includes heightened hygiene, exercise, and eating right. But maintaining good health during the quarantine means following guidance for covering your face in public and considering paying extra attention to your eating habits, exercise, and personal schedule. Be good to your body by keeping yourself healthy with physical activities and a good diet by staying active, keeping your bedtime the same, and eating regular nutritious meals. Be kind to your mind by engaging in your favorite activities. Avoid information overload, practice self-care, utilize mindfulness and meditation, and ask for help when needed.
Technology has changed significantly over the past decade. COVID-19 has enhanced our utilization of technological resources to communicate. We are now using existing platforms such as Zoom and other video conferencing programs as a standard as opposed to as needed. Kara, what are some ways have you observed people using technology?
Dr. Carroll, when I tell you I have observed many things that are so unique and creative, I'm going to take this time to point out two. Okay, there have been some of the things or ways that I've seen are the use of social media platforms for church services, for live viewing, and later sending the audio recording out in emails and uploading the recording that can be viewed on other platforms that don't require social media accounts. I've also seen virtual graduations, and celebration parties, as well as virtual birthday parties. But one of the most unique things I've heard is a family hosting their family reunion via Zoom. They are still ordering t-shirts, and the family will have a specific window of time where they can tune in and play interactive games led by the members of the family who've planned this event. They'll view a slideshow of pictures and videos created specifically from their Zoom calls that they have been having since we've had to start the quarantine. And on that Sunday, they will have their closing service led by the minister in their family. Another thing that I've noticed is that some school districts have begun to send out surveys to gauge parents' thoughts on how the upcoming school year should look. They were polled on their thoughts of various options, such as complete virtual learning, rotating days in and out of the classroom, and combining in-school and virtual options. Dr. Carroll, these examples are just a few of many ways that we have adapted and are coping with our new normal.
As a behavioral health agency, we have used a combination of on-site and telepsychiatry services for years leading up to COVID. Many people with and without major health concerns are calling or video conferencing their medical health professionals to receive services. During the outbreak, telemedicine has been expanded to provide mental health support. The vision of rolling out systematic, accessible, and comprehensive mental health support for healthcare workers and the general public was made possible by many popular online platforms. Finally, working from home. The concept of work from home is truly not a new one. It is a very common practice for some, such as online professors, customer service representatives, and online stores, to name a few. While this has been a common practice for some time, the surge of individuals working from home reached an unprecedented number, which required us to create new habits and protocols as a result of changed working environments.
According to reports, about a third of Americans are working from home because of the coronavirus. While many have begun to transition back into the traditional work environment, many still remain home and will be for an undetermined amount of time. If you're new to the work from home lifestyle, you'll need to change some of your habits and routines to make working from home a success for your job performance and personal life. Everyone who works from home has to figure out where to work and how to create boundaries between work and personal life. It is important to maintain your regular hours as required, create a dedicated workspace to work from, control noise, take lunch breaks, be positive, and end your day with a routine. For many of us, working from home can be difficult, especially when there are children or pets in the home and other distractions that are not typically found in the workplace. Figure out what works best for you and talk with your peers to discuss ways they have adapted to this new normal.
Above and beyond the everyday project management of your work from home employees, managers should employ some additional steps that recognize the difficulty and changes their employees are experiencing at this time. Outside of work, individuals are battling with many unknowns relative to COVID-19. In addition, maintaining their health and wellness. I'll share two with you. Check-ins during standard meetings. Although not mandated, it's important and appreciated when you take some time to assess the status of your employees. This can be done during a standard meeting or by email. This gives employees a chance to address stress and receive positive feedback and words of encouragement from other staff meetings. Gratitude. A general rule of thumb is to acknowledge good deeds or exceptional work and express gratitude. This should continue during COVID-19, and as managers, we may want to expand our criteria for expressing gratitude. Frontline health workers are integral to the global response to COVID-19. In hospitals, clinics, and homes around the world, health workers are taking on significant personal risk. The current crisis is demonstrating the essential, tireless, innovative, and too often undervalued roles of healthcare workers in ensuring strong, resilient health systems for everyone, everywhere. Due to the high risk associated with this profession, you might see or experience the following. The pain of loss. Our coworkers are very much like extended family, and their illness and death affects us. Fear of transmission. As hospitals and other healthcare providers receive priority for protective gear and federal funding to battle the coronavirus, emergency medical responders worry they'll be left behind. It's still unclear exactly how many medical workers have been infected since the outbreak began in the United States. Fear of transferring coronavirus. With the increasing number of positive cases and the incidence of contracting COVID in high-risk jobs, it is common to fear exposing family members to the virus. Behaviors associated with fear. Stresses have a major influence upon mood, our sense of well-being, behavior, and health. There are several warning signs that we can easily recognize within ourselves, such as problems sleeping, muscle tension, changes in appetite, and indigestion problems. There are some tips to help address high levels of stress, and we recommend talking with a healthcare professional to address chronic and prolonged stress. The obvious burnout and thoughts of mortality. With the alarming rate of mortality associated with COVID-19 and having firsthand access to these dire situations, it's very likely that first responders begin to think about their own mortality.
Due to COVID-19, many people are at a high risk for stress. As Dr. Carroll just highlighted, many of the things that frontline workers and first responders may experience, it is important to remember that any of us can become overwhelmed with all the things that are going on around us. Resources and physiology are two areas I would like to use to address how people may react differently to stress. The level of resources available can make a significant difference in what level of stress someone may experience in a given situation. The difference in available resources is a major factor in why two people may face the same situation and experience it differently. Differences in physiology, such as differences in temperament, can cause some people to be naturally more resilient in the face of stress. Dr. Carroll covered resiliency further back, while others can feel more threatened and less able to cope. While we can't change the temperament we were born with, we can increase our awareness and work to build coping skills that help to build our personal resilience. Again, COVID-19 is new to us all and requiring each of us to constantly adapt, cope, and recover as new information is discovered and shared. If you are someone who gets stressed easily or has been feeling more stressed lately, work on ways to build your resilience and resources by asking for or seeking help in stressful situations. Even before COVID-19, many clinicians already face burnout as well as stress, anxiety, depression, and substance abuse. Now this global public health emergency is presenting clinicians with even greater workplace hardships and moral dilemmas that are very likely to exacerbate existing levels of burnout and mental health problems. During this challenging time, we should all aspire to follow clear strategies as healthcare leaders and as individual clinicians to help sustain the well-being amidst the COVID-19 pandemic. Here are 7 suggestions listed on the screen that can be used to support yourself and your colleagues. These are just a few if you are struggling to think of things, or some that you can add to what you have currently implemented. It's important to remember that meeting our basic needs by performing self-care, taking breaks, staying connected, and honoring the service you are providing are all things to help promote a positive attitude and work environment while we ourselves adapt, cope, and recover during this time.
Working in the healthcare field can be as equally rewarding as it is overwhelming. Below are some strategies for behavioral health and primary healthcare leaders to support positive well-being of staff. Value clinicians. Retention of productive employees should always be the goal. It is more efficient to retain a quality employee than to recruit, train, and orient a replacement employee of the same quality. During this time, empathy and understanding is key. According to Forbes, 96% of employees believe showing empathy is an important way to advance employee retention. Providing supportive environments. Creating safe and supportive environments helps maintain good employees. And also, creating a hub of accurate and viable information is essential. Oftentimes in the healthcare field, not only are our clients and patients need support, but so does the employee. And finally, provide appropriate resources if clinicians are infected. Not only providing the appropriate resource, but also being responsive. Employees like to know that if they're in a crisis, their employer cares. As we conclude with ways to cope, it is advisable to contact a healthcare professional before you start any type of self-treatment for COVID-19. As a reminder, there is a wealth of information out there, in addition to this presentation being available to you on the YouTube channel. And lastly, Northeast Delta has a web page specifically dedicated to COVID-19. The information is taken from reputable sites and is presented in a user-friendly format.
Yes, Dr. Carroll. Northeast Delta Human Services Authority has taken responding to COVID-19 very seriously, not only for us, the employees, but also for those who need us and that we serve. I know there are times we feel like we are alone, but it's important to remember that none of us are alone in our roles of adapting and coping as things change. I don't think we can say that and point that out enough. By taking care of your body, connecting with others, and connecting with your community or faith-based organizations, you help to build your resiliency and social support systems in unique ways to help you through these times.
A pandemic isn't an isolated incident. It is, by definition, an unfolding global event. It may seem difficult to imagine now, but the coronavirus lockdown will end. One day, when the numbers tell us it's safe, we will leave our mask at home and return to the streets, revive the economy, and reestablish our routines. The question, increasingly, is no longer whether we will return to normal after the pandemic, but whether we really want to return to normal. Here are 5 rules of recovery. I developed this from several addiction recovery models. The information is suggestive and should be used for informational purposes. In light of COVID-19, we are forced to reimagine life. So sometimes we have to create a new normal. Supportive circles are vital in addiction recovery and could be helpful during isolation. Remember, self-care isn't any activity that we do deliberately in order to take care of our mental, emotional, and physical health. Keep in mind that there's a strong connection between your body and your mind. When you're caring for your body, you'll think and feel better too.
Thank you, Dr. Carroll. Now I'll take the time to review the next 3 slides just to remind you of the agencies and our services that Northeast Delta Human Services Authority is providing throughout our 12 parish service area. We operate 6 mental health and substance abuse clinics throughout the 12 parish service area. The Monroe and Bastrop clinics are piloting our integrated care program in addition to providing mental health and substance abuse treatment. The Developmental Disabilities Community Service Office serves as the regional single point of entry into the state of Louisiana's Developmental Disability Service System. And the Peer Support Center located in Ruston provides peers with lived experiences with mental health that serves as a guide by using their own lived experiences and training. All of our clinics provide services to individuals regardless of their ability to pay. We are the state's safety net for mental health, substance abuse, and developmental disability services and access to treatment. Northeast Delta operates 2 24/7 crisis hotlines, and you can see the numbers listed here on the screen. One is for mental health and addictive disorders, and another is for the developmental disability services. There is someone answering the call of those in need, regardless of the hour, and able to provide the appropriate interventions and make the necessary referrals for treatment. And also our Prevention and Wellness Center, which I will discuss the services that we provide in the next slides. Northeast Delta Human Services Authority community programs are offered through many community partners. Support services, which provides housing, homeless outreach, and job placement, is provided through Easter Seals, Rays of Sunshine, Goodwill Industries of North Louisiana Incorporated, and Wellspring. Addiction services, which provides inpatient addiction treatment, is provided through Ravel Recovery, Lark Recovery, and Rays of Sunshine, and outpatient addiction services for gambling and smoking cessation are provided out of the Monroe Behavioral Health Clinic. Prevention and Wellness Services, which provides evidence-based programs facilitated at schools throughout Northeast Louisiana, are provided through Children's Coalition, West Carroll Safe and Drug-Free Volunteers Incorporated, Louisiana Center Against Poverty, and Goodwill Industries of North Louisiana Incorporated. Northeast Delta Human Services Authority's Prevention and Wellness Services are information dissemination on opioid prevention, safe medication and disposal, and underage drinking and bullying. Our community education focuses on Narcan education and Generation RX, among other things. Alternative activities for youth that we provide and sponsor are student ambassadors, youth summits, and student retreats. School-based interventions are provided through evidence-based programs through the community partners that I previously mentioned, and health and wellness classes are through our integrated health programs at the Monroe and Bastrop clinics, and they are done by creating awareness, motivation, and providing tools to help to adapt and maintain a well-rounded, healthy lifestyle. And our trauma-informed care through Adverse Childhood Experiences Talk, providing training and preventative measures to create safe, stable environments while helping children build social, emotional skills and resilience. And I want to point out that we have another webinar in this series on Monday that is going to focus primarily on the Adverse Childhood Experiences Talk with Dr. Carroll. And finally, building alcohol and drug-free communities through coalitions. We have 3 coalitions in Northeast Louisiana, 2 in Ouachita Parish, in Monroe and West Monroe, and 1 in Franklin Parish. And the goal of these coalitions are to recognize that alcohol, tobacco, and other drug abuse is a serious social and public health issue that, when addressed by multiple members and partners in the community, will create a climate of healthiness and community wellness for all of Northeast Louisiana and Louisiana as a whole. And finally, in conclusion, we hope that you enjoyed what we discussed today. But we want to point out that if you or someone you know is having difficulty coping, that Northeast Delta Human Services Authority is here to help. Please feel free to call our 24/7 hotline at 1-800-256-2522. And now we will turn things back over to Alan so that Dr. Carroll can proceed with our question and answer period.
Thank you so much. Now we will take questions via the Zoom chat feature. If we are unable to address your question today for any reason, we will follow up via email as soon as possible. And prior to our webinar beginning today, we did have some questions submitted. Now, Dr. Carroll, the first question, you gave great discussion about how managers can support their employees, but how can managers support themselves during COVID-19?
That's a really good question. One of the things that managers can do is first connect with other managers. Due to the highly technological age that we're in right now, starting a group chat or video conferencing with other managers and sharing some of the same issues and building that support group tends to be very helpful. Also, setting some realistic expectations for yourself and others. It's very easy to set expectations for your staff, but you have to remember that in COVID-19, we are dealing with a great amount of stress and anxiety and different with this new normal. So making sure that you set some expectations for yourself that are realistic when it comes to your work. And the last thing I would say is talking to a professional. I say this a lot, and I've mentioned it a lot during our presentation because there's such an enormous stigma around mental health. And I like to refer to it as mental wellness. And so speaking to someone and developing a plan of action and a therapeutic plan to help you determine what your needs are and how to get to a better place can be done in conjunction with a counselor.
Thank you for that. Another question that was asked prior to our webinar today is that Northeast Delta Human Services Authority quite often talks about social determinants of health. Now, are social determinants of health impacting COVID-19 and COVID-19 related cases?
I would have to say yes. And I say that because the research is suggesting a strong correlation between cases and social determinants of health factors. And although there are many people and healthcare workers and public health professionals are working tirelessly to eliminate those barriers, there are still issues that exist. Some of the things we're doing to mitigate the social determinants of health as a nation and especially as a state is making testing more accessible and making them free, which addresses transportation and socioeconomic factors. In addition, we're giving out masks and food, and these are also things that put individuals more at risk if they don't have access to it.
Thank you, Dr. Carroll. And in light of no questions coming into the chat, at least at this time, we will go ahead and close out for today. So everyone, thank you for joining us today. The contact information for our presenters, Kara Jackson Etienne and Dr. Avius Carroll, is there on your screen for you. And we invite you to please visit our website at www.nedeltahsa.org and follow us on our various social media handles at NEDeltaHSA. Please join us on future presentations of this webinar series by the Prevention and Wellness team at Northeast Delta HSA. Our final webinar being presented via Zoom is on adverse childhood experiences with Dr. Avius Carroll this Monday, June 29th at 1 p.m. Central Standard Time. We are here to improve education awareness, advance community discourse, and focus on recovery during social distancing and other issues enhanced by COVID-19. Together, we, Northeast Delta Human Services Authority, and you are building stronger communities together, one person at a time.